Once again, good afternoon to everybody. I am very pleased to welcome all the participants to this side event on the human rights dimension of drugs policies as part of the activities celebrating the 50th anniversary of the Pompidou Group. Portugal, as presidency of the Pompidou Group for the period 2019-2022, is very honored to co-organize this side event together with the Council of Europe and Poland, the Vice Chair of the Pompidou Group. 2021 is a year for celebration for all of us. 50 years ago, the French President Georges Pompidou, recognizing the importance of a coordinated response towards the global drugs problem, proposed the creation of an European cooperation framework to fight against drug abuse and drug trafficking. In the last years, the drug situation changed substantially all over the world and in Europe, with new patterns of use, new psychoactive substances appearing in the market, and new traffic routes emerging. Over the last 50 years, the Pompidou Group has been the voice of the Council of Europe on drug issues. In an international environment, it remained firm on promoting a balanced approach between the necessity to tackle drug abuse and drug trafficking and the responsibility of states to protect the health and human rights of people. The Pompidou Group evolved in its tasks and objectives and is now a forum for open debate, exchange of knowledge and experiences, and a platform for science and evidence-based innovation, linking policy, research, and innovation for professionals, experts, researchers, and policy decision makers. With the recent accession of Armenia and Georgia, the group grew from 7 initial states to 41 members. Its activities have extended well beyond Europe, and it has established several memoranda of understanding with international organizations. In order to better reflect the new developments in drug policies and the challenges ahead, the Pompidou Group launched in 2019 an open discussion with its members and a wide-ranging consultation process, including civil society organizations, on its mandate, operation, and working methods, in order to more effectively reflect today's drug policy evolution and the challenges faced at national and international level. The revised statute is due to be adopted by the Committee of Ministers of the Council of Europe later this year as the major highlight of the Pompidou Group 50th anniversary celebration. Pompidou Group, under the Portuguese presidency, has been focused in bringing public health and the respect of human rights to the forefront of drugs policies. The current work program, entitled Sustainable Drug Policies Respectful of Human Rights, emphasizes the need to integrate human rights into the development, implementation, monitoring, and evaluation of drug policies. Human rights are a transversal issue present in all Pompidou Group activities, and we believe that regular cooperation of governments, experts, professionals, representatives of the civil society, along with relevant international organizations, is key to develop balanced, evidence-based, and comprehensive and human rights respectful drug policies. Last year, a new project was launched at the initiative of the Portuguese presidency to analyze the impact of human rights on drug policies and on how they can be instrumental in reducing unwanted effects and unattended consequences of responses. The work aims at the development of a set of tools and markers to assess the level of human rights compliance of different drug policy options and interventions which will be presented by the end of this year. Presentations on this side event will focus on the achievements of the Pompidou Group, the human rights approach to drug policies and its paths into the future grounded on the revision of its founding statute. Well, to start with, I will first give the floor to Anna Trudov from the Pompidou Group Secretariat. She will have a multimedia presentation. So, Anna, please, you have the floor. Thank you.
Thank you. Thank you for giving me the floor. Good afternoon, everyone. My name is Anna Trudov, and I'm working within the Secretariat of the Pompidou Group. Thank you for having me today. It's an honor to participate in this event. I propose to look back over the Pompidou Group's achievements during the past 5 decades. So just let me start sharing my screen. Can you see my screen? Could you please confirm?
Anna, we can only see that you're trying to share your screen.
Yeah.
Well, I will try again. Stop sharing. Can you see now?
Yes. Yes, now
Okay.
it is. Okay, thank you.
Yes. The Pompidou Group was founded in 1971 upon the initiative of the late French President Georges Pompidou. He addressed a letter to prime ministers of 7 countries in which he proposed a coordinated fight against drug trafficking at a European level. The group developed as a unique entity throughout the 1970s, and 3 other countries, as Denmark, Ireland, and Sweden, joined it during this decade. In March 1980, the decision was taken to integrate the Pompidou Group into the Council of Europe's political and legal framework by means of the resolution adopted by the Committee of Ministers in 1980, signed by 10 member countries of the group at that time, joined by Turkey. This resolution gave the Pompidou Group the status of an enlarged partial agreement of the Council of Europe and established 2 objectives of the Pompidou Group, which are to carry out a multidisciplinary study of the problems of drug addiction and illicit drug trafficking, and to maintain within this framework of this partial agreement the working methods used until now by the group. After its integration into the Council of Europe, Pompidou Group continued to grow with the accession of 8 countries. On the eve of the Berlin Wall's fall, the Pompidou Group brought together almost all the countries of Western Europe. With the establishment of its group of experts in drug epidemiology in 1982, the Pompidou Group was a pioneer in the development of research and monitoring of drug problems in Europe. As a follow-up, the Pompidou Group carried out a comparative epidemiological study of drug abuse indicators in 7 European cities. The aim of this study was to develop the drug abuse indicators used in the different cities and to improve the understanding of this data within the Pompidou Group. The results of the study were published in a report, and it's important to highlight that this study contained a recommendation to set up a European agency whose mission would be to provide member states of the European Union with objective and comparable information on drugs and drug addiction. In response to this recommendation, the European Monitoring Center for Drugs and Drug Addiction was created in 1993. After the fall of the Berlin Wall, the Council of Europe expanded to include the countries of Central and Eastern Europe. In consequence, 7 countries joined the Pompidou Group during this decade. By the end of the 90s, the Pompidou Group comprised 26 member states. In order to achieve more effective control of drug trafficking in general aviation, the Pompidou Group has set up the Airports Group, which regularly provides member states with the latest information on the modus operandi of drug traffickers in civil aviation and on the technical measures needed to neutralize them. The aim was to develop a harmonized multidisciplinary strategies for drug detection at the European airports, and of course to strengthen the cooperation between airports on this subject. Pompidou Group launched the first European Drug Prevention Prize in 2004. This prize is awarded to highlight outstanding drug prevention projects that have proved successful in involving young people in their design, implementation, and evaluation. It aims to increase awareness of the importance of active youth participation in reducing drug-related harm and creating healthier citizens and communities across the Europe. The highlight of the 2006 year was the creation of MedNet, the Mediterranean Network for Cooperation on Drugs and Addictions. This network promotes the exchange of knowledge between countries from both sides of the Mediterranean. Due to this cooperation, the access to care for all persons who use drugs is being improved with opiate substitution treatment in Morocco, in Lebanon, as well as in Algeria. The gender dimension is being gradually integrated into drug policy, with the specific needs of women being taken into account. And the human rights dimension of drug policy is being discussed, and the first to report on human rights and people who use drugs in 17 MedNet countries has been published. And you can, this report is available in English and in French as well on our website. It's important to highlight that in 2021, we will be celebrating the 50th anniversary of MedNet. Poland's presidency of the Pompidou Group took the initiative to launch the executive training on drug policy in 2009. With the first training course taken off in 2010, it quickly became a hallmark activity of the Pompidou Group. The executive training courses provide know-how and help to build skills and competencies for more effective policy development, management, and evaluation. From 2010 onwards, the Pompidou Group went through a period of upheaval. Against the backdrop of the financial crisis and political tensions, 5 member states decided to withdraw. 6 other countries joined the group in parallel. This period was characterized by a significant reduction of human resources, which led to a major revision of its work program. The Pompidou Group activities have been refocused on the importance of ensuring full respect for human rights in the adoption and implementation of drug policies. And this is, which was in line with the Council of Europe's core mission. The group also taken the initiative to introduce a gender dimension into its work. And this refocusing and these efforts have helped to restore the group's relevance and activities, as evidenced by the successive accessions and the first time the accessions of non-European states like Morocco, Israel, and Mexico. The 2012 was highlighted by the launch of the Drugs in Prison program, which supports governments to develop evidence-based criminal justice policies and comprehensive drug treatment systems in prisons. Within the framework of this program, the Pompidou Group managed to organize several conferences, study visits, and workshops in the countries of the Southeast Europe, such as the workshop in Ukraine, where it was discussed the urgent steps to implement opioid substitution treatment and drug overdose prevention programs in the country's prisons. The Pompidou Group has produced several publications and policy papers in the field of gender dimension of non-medical use of prescription drugs in Europe and the Mediterranean region, government interaction with civil society, drug treatment systems in prisons, drug policy and human rights in Europe, and all these publications are available on our website, mostly in English, so you can always consult them on our website. During the ministerial conference held in Stavanger in 2018, the Pompidou Group's member states decided to initiate a process to review the group's mandate, operation, and working methods in order to more adequately reflect today's drug policy evolution. The main issues discussed to be addressed in the revision of the statute are firstly extending the mandate of the Pompidou Group to other forms of addiction beyond the field of illicit drugs. Secondly, focusing on the respect promotion of human rights in designing adoption and implementation of drug policies, and creating synergies with other international organizations, relevant entities of the Council of Europe, and of course with civil society organizations. After 10 years of success in the training field, the Pompidou Group launched the International Drug Policy Academy in 2019 in cooperation with the University of Malta and Syracuse University of United States. The Academy offers the opportunity to obtain a certificate in drug policy management and also a full-time course leading to a diploma in drug policy. The ministerial conference held in Stavanger in 2018 provided the opportunity to adopt a new work program for 2019-2022, which is currently implemented. Ministers also adopted a political declaration, the Stavanger Declaration, which highlights the main issues and challenges currently faced by national and international decision makers and the role they wish to assign to the Pompidou Group in this regard. In 2021, the Pompidou Group celebrates its 50th anniversary with an ambitious agenda, as you can see on the screen, to promote human rights at the heart of drug policy. We are using this occasion of the anniversary year to continue the successful path into the future together with our member states and the partners. To highlight the main achievements and contributions of some eminent personalities in the history of the Pompidou Group, a commemorative event will be held at the Centre Pompidou in Paris on 28 October 2021. And on this occasion, the award ceremony for the European Drug Prevention Prize will also take place. I'd like to thank you for your attention. It was a pleasure to highlight all these achievements accomplished together within the Pompidou Group during all these years. I'm honored to be part of this incredibly talented team, and I wish to Pompidou Group a happy and long life. I hope it will continue to grow and to achieve great results in the future. So thank you again for your attention. If you have any questions, you can always write them in the chat tab. So thank you.
Thank you, Anna, for this very interesting journey. You drove us through time in a very, very interesting way. Thank you for that presentation. I think, for the sake of time, it's perhaps better to deal with questions by the end of the presentations. So I ask the participants to put their questions on the chat, and we will try to reply to them by the end of the session. Meanwhile, thanks again. It was really very, very interesting. And I will now invite Piotr Jablonski, our Vice President, Director of the National Bureau for Drug Prevention of Poland, and one of the long-lasting members of the Pompidou Group, and very productive in contributions for the work of the group. I now invite Piotr to talk a little bit about the training of professionals for dealing with drugs, for developing and sustaining humane drugs policies. Piotr, please, you have the floor.
Thank you very much, João. Welcome, everybody. Ladies and gentlemen, thank you for inviting us to participate in such an important event. 50 years of Pompidou Group existence, it's 50 years of success in promoting a modern, science-inspired, stereotype-free and focus on the rule of law and human rights policy of counteracting the effects of drugs and drug addictions. The 50 years of Pompidou Group, it is additionally 30 years of Polish participation in group activity. Poland joined group in 1991, and since the beginning we are trying to play an active role within its structures. Our experience is the process of moving from the role of beneficiary country using the group achievements to the role of active participant and partner in numerous projects, and finally to the role of country taking joint responsibility for the functioning of the group and the implementation of its mission. I recall these experiences of our participation in the group's activity as they have become one of the sources of inspiration to propose to the group a training system for people involved in planning and implementing activities in the field of drug policy. The basic idea of promoting training based on scientific evidence and rooted in the ideas of human rights was developed during the Polish presidency of the Pompidou Group in 2007-2010. When proposing to take up such an idea, we had a few facts in mind. Pompidou Group in the 90s carried out a series of trainings with great success called Demand Reduction Staff Training Program, training for so-called drug policy makers and drug policy planners. People, experts participating in the training highly rated the practical usefulness of the experience gained and some of them are active participants in the drug policy area to this day. I'm the example. At the beginning of the 21st century, during the presidency of the Netherlands, under the leadership of the Dr. Bob Kaiser, at that time Poland was the vice presidency of the group, in discussion on the need to modify and modernize the mission and role of the group, there were ideas to transfer at least a part of the group into the so-called drug academy as the result of growing awareness of the need to propose the international community to work to improve the standards and quality of drug policy. The idea of combining the experience of science, practice, and research into integrated system of influences carried out by the group led directly to the thought that the logical complement to these areas is to base the drug policy on the need and rights of people affected by the problems of drugs and drug addictions. The inspiration that gave us the additional impulse to our activity were thoughts written down by the Professor Uchtenhagen. People using drugs have the right to life, liberty, bodily integrity, privacy, education, equality before the law, freedom of movement, assembly, and association. This is broadly understood and agreed. Second thought is much more complicated. The central point of citizens' civil rights in democracy is that the individual can finally choose his lifestyles and goal in life within the limits of the given norms. This is also valid when his choices, apparent or actual, are hardly beneficial to his interest or even disadvantageous. Why we consider this sentence so significant in that time and still today? On one hand, in recent time, many international bodies have stressed the importance to focus on human rights in drug policy, but there are no legal instruments that directly refer to human rights in drug policy. The only exception is the United Nations Convention on the Right of Children. Children are to be protected from the use of narcotics, drugs, and psychotropic substances. On the second hand, in the opinion of many entities, for example, Human Rights Watch, in many countries around the world, drug control efforts result in serious human rights abuses. There is still so many examples: deadly drug penalty, denial of harm reduction services, deprivation of treatment, restriction of access to controlled medicines, abusive law enforcement practices, coercion in case of treatment, discriminatory practices faced by women and young people. Because human rights violations bring about negative health effects for drug users and the communities in which they live, a logical step forward is to ensure that drug policy and demand reduction policies are by nature and implementation consistent with human rights obligations. All above mentioned facts led us to the idea to propose permanent correspondence of Pompidou Group, the concept of establishing new mechanisms within group, providing training curricula and training for various stakeholders on the interconnectedness between drug policy, health, and law on human rights. The training concept has gone through several development phases. We started with the initial form, which we called the Training Initiative in 2009. After obtaining the approval of permanent correspondent, the advisory group on pilot training course was established, which developed a basic principles and training program. At this point, it is necessary to mention the merits of colleagues from Switzerland and above all, Dr. René Stamm, and from Pompidou Group Secretariat, Dr. Patrick Pennings and Dr. Thomas Katau, to develop a comprehensive training profile. The first training session took place at the end of the Polish presidency, 2010. The training formula was modernized and now functions as the Drug Policy Academy, but it invariably combines elements of science, practice, and politics with the principles of human rights, the rule of law, and respect for basic humanitarian values. Which makes Pompidou Group trainings unique. Focus on participation needs, highly interactive training, including study visit, diversity of participants, different professional backgrounds, involvement of participants and experts from Americas, and cooperation with a removed university in the United States, Syracuse, and the first Pompidou Group activity that was regularly evaluated from the beginning by participants. Ladies and gentlemen, today's words differ in terms of assessing the risk of addiction, but we believe that strengthening the supply and demand reduction drug policy by underlining the importance of human rights and promoting the public health philosophy create gold standards of the evidence-based approach to the addiction phenomenon. The COVID-19 pandemic and its dramatic impact on health and safety provides additional argument for placing human rights at the center of undertaken actions. Drug addicts and those affected by drugs and drug addiction are often last in the line for the attention of policymakers and politicians, often marginalized by various systems and institutions. Therefore, the awareness of their subjectivity must be further maintained, and it is done by Pompidou Group. Thank you very much for your attention.
Thank you very much, Piotr, for your very interesting presentation. It also tells us the story of the development of the activities of training and the better preparation of professionals and policymakers. I will now give the floor to Richard Muscat, Chairperson of the National Addiction Advisory Board from Malta. Richard, please, you have the floor.
Thank you, Joe. Can you hear me? Can you hear me?
Yes, very well. Yeah.
Thank you. Well, thanks, Chair, and good afternoon or good evening or good morning to all the distinguished gentlemen and ladies and participants. I just want to pick up on a couple of aspects that Piotr was talking about and Joe was talking about, that the Pompidou Group has been at the forefront of human rights for at least, I think, a number of years and possibly more than 10 years. And I think a human rights drug approach to drug policy in this day and age, especially with the pandemic, is more than ever required. In that, I mean, with all drug policies, I think the central tenet is that one should uphold the dignity of the individual. And this is, really absolutely clear if we look at the Universal Declaration of Human Rights in 1948, or even the European Convention of Human Rights in 1950. The first article in most of these articles, there are 30 or 31 articles in the Universal Declaration of Human Rights, and about 61 or 67, I think, in the European Convention. But the key in all of them, and I read the first article of the European Declaration, is that all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood. In other words, as Confucius said about I don't know how many thousands of years ago, do unto others as you would have others done unto you. And I think this should be the central tenet of any drug policy. In recent years, the Pompidou Group has followed this tenet, and it also takes on board the tenet of, or the edict of the WHO when it was formed in 1946. And that the key statement here is health is more than the absence of disease or infirmity, and more to do with one of social and mental well-being. However, as you know and I know probably, we view drug users, as Piotr pointed out, as sometimes marginalized in our societies, which is absolutely wrong. However, we can do better if we look at how we treat drug users from a law and order perspective, and probably from the social and health domains. And we should be able to do better here. Hence, I would suggest that we need instruments in place that, in addition to helping and designing and developing drug policies that are science-based, as Piotr mentioned, also means through which they can be monitored and, in effect, are compliant with human rights obligations. As João mentioned, there is a project which is ongoing, which is chaired by Portugal, which we're actually doing this. We're looking at specific, maybe markers or indicators, as to create a self-assessment tool that enables countries themselves to look at whether they're being compliant or not. I'll start with a particular example about compliance. One of the things that we do, or some people do, or some countries do, is that if people use drugs for personal use in some places, you are put in prison. And so the first thing that comes to mind here with human rights obligations is if you happen to be using drugs and sent to prison, there should be an equivalent of care as there is in society. So the idea is not to send people who use drugs to prison, and there are, in the 1988 convention, there in the plenary session, I think there was a celebration of the 50th and 60th anniversary of the 1961 convention and the 1971 convention. But in the 1980 convention, there are mechanisms through which, if one uses drugs, then one can, have a system through which the individual may seek help or treatment, etc. But if that's not the case, and then one has to go to prison, then there should be an equivalent of care in prison. And sometimes this does not happen. So in the law system or the judiciary system, there are problems with actually providing the same systems of care as there are in society. The second example is that in addition to being able to be a provision of care, one may want to think about how accessible is that care to the particular individual and what are the available services. In some countries, as was pointed out this morning, for example, opiate agonist treatment is not available. So therefore, it's very difficult to deal with the problems with the individual, say, within the particular country. So availability and access are a major issue, and we need to do better than this. In addition to that, is if the services are both accessible and available, sometimes drug users don't want to come forward because of all the stigma attached to being called a drug user, etc. So we need to do better at, not discriminating against drug users for having used drugs. These three examples, if you like, which touch on law and order, the judiciary, the social and the health domain, as I pointed out, are an ongoing project with the Pompidou Group, in which the Portuguese, our Portuguese chair chairs the group, and we're in a position at this moment in time where we've created a marker system, or maybe now we're moving to one that's called a traffic light system, in which countries will be able to self-assess whether they are actually, sticking to principles of human rights, and if not, they can, seek to redress the inconsistencies as required. Now, the second part of my short intervention is about inconsistencies or coherencies. And coherence is one of the most important aspects of drug policy. All the bits and pieces of drug policy should be able to fit together and produce the required good. And now the word, coherence takes on so many different forms. But the simple thing is I went up and looked up an English and Cambridge Oxford dictionary. And at least it says to be consistent and logical. And therefore the chances are you're coherent. But in effect, I think the best way to think about coherence is probably, if any of you doctors out there and you've taken the Hippocratic Oath, the main important bit of the Hippocratic Oath and medical ethics is that one does no harm, do no harm. So if your policy may be coherent, may be compliant, at the end of the day, ensure it does no harm. So as the chair was mentioning in the beginning, try and negate any negative consequences. A second, sort of definition of coherence is it's the glue that binds everything together. And I remember my colleague Bridget Pike, who together worked with us on the Coherency Marcus project some years ago, reminded me, yes, that probably that is one of the best ways to define what coherence actually means. Probably a third way is probably because my background is in science, is in that, radio waves and light waves are considered to be coherent when there is a phase relationship. And more so from my discipline, cognitive neuroscience, our brain waves are said to be coherent when they enable us to perform with wonderful ease. Thus, a drug policy nowadays should in fact at least do no harm. At best, address the problem at hand with a human rights perspective and use these building blocks, both of compliance and coherence, to ensure one is able to do so. So, finally, back to the start, human rights, our central focus of drug policy. I think we need better, we must do better with compliance. And hopefully, by the end of the year, we'll have a tool in which the countries will be able to self-assess whether they're doing this or not. And in addition, maybe we can add the other projects to this particular project, that of the markets developed for coherence, to ensure, in addition to being compliant in one of the fields, the whole policy is coherent. Thank you for your time and patience. Thank you. Thank you very much.
Thank you, Richard. Thank you for your presentation and for the reflections that you brought to us. I must say that we are very much committed in building the tool to self-assessment, and you stressed it very appropriately. We do not intend to put negative observation into countries. What we would like to provide is in fact a tool that any country, any organization can use and better assess if they are complying or not with the big, nice principles of human rights. So I think you brought it to us very clearly. Thank you for that. And now let's move to Denise Hubert, the Executive Secretary of the Pompidou Group, to talk a little bit about is the Pompidou Group fit for the future? Please, Denise, you have the floor.
Thank you, João. Can you hear me?
Yes.
As it has been already mentioned, 2021 is the year of the Pompidou Group 50th anniversary, and it is, of course, the opportunity to look back at the past. This is what we have done with the presentation of my colleague Anna, but it's also a unique opportunity to project ourselves in the future. And of course, the future of the Pompidou Group will be mainly defined by the new statute, which is currently being discussed within the Committee of Ministers and hopefully will be adopted by the summer. We have been working over the last 2 years to prepare the statute, and I would like to thank very much the Portuguese presidency for having led this process, and also all Pompidou Group member states for their spirit of compromise. Because we managed in November 2020 to have a unanimous approval among Pompidou Group member states on the new statute. What does it contain? First of all, the new statute will reaffirm the multidisciplinary approach of drug policies, which has been in the DNA of the Pompidou Group since the beginning. It will also extend the mandate of the Pompidou Group, not only to illicit drugs, but also to other forms of addictions, especially the new challenges which are posed by internet, such as gaming or gambling. As already mentioned, in the new statute, there is also a strong focus on human rights. Of course, human rights have been in the forefront of the Pompidou Group action over all its existence, and especially over the last 10 years, as it has already been mentioned. But the idea is now to make this statutory mission of the Pompidou Group, which of course is a big step forward. Then we will also, in the new statute, clarify the identity and the added value of the Pompidou Group by strengthening the link of the Pompidou Group with the Council of Europe. The Pompidou Group is the Council of Europe body dealing with drug policies, and this is its identity and also its added value. By doing this, we will also strengthen synergies, not only with other Council of Europe entities, but also with our main international or regional partners. And I would like to highlight that very recently we have had a new cooperation agreement between the Council of Europe and the Organization of American States in the field of drugs, and the Pompidou Group and CICAD will be entrusted by the implementation of this new agreement. And of course, we want also to reinforce our links and our cooperation with civil society, because we of course consider civil society as a major partner, especially if we want to develop the human rights dimension of drug policies. The draft statute, which has been approved by the member states of the Pompidou Group, is currently under discussion in the Committee of Ministers. It started already in January, and it will continue this week on the 15th April at the specialized rapporteur group of the Committee of Ministers, which is dealing with social and health issues. And we hope that the statute will be adopted by the summer, as I said already. Looking always to the future, it has already been mentioned that we will celebrate the anniversary of the Pompidou Group at the Pompidou Center in Paris at the end of October, and the closing event of the 50th anniversary will take place in Lisbon at the invitation of the Portuguese presidency. And we will, of course, have the opportunity in Lisbon to look even more closely and even more attentively at the future of the Pompidou Group. Thank you very much.
Thank you, Denise, for this presentation. You made it short, I believe, because you had a lot to say, and I want to thank you and all the Secretariat on behalf of the Portuguese Presidency for your intensive work in this revised statute and the negotiations and the sharing the new ideas with several groups. But I think we should take this short time that we have left to try to answer to some questions that I see on the chat. Maybe Ursulia can
Yes,
address it. Okay, please do it.
Yes, of course. First of all, thank you to all our presenters for these very interesting contributions. We have 3 questions in the chat and in the Q&A. I would start first by the question by Ruby Lawlor, which perhaps goes to Richard regarding the human rights self-assessment tool. The question is, how do you plan to ensure that countries are truthful and honest when using the human rights instrument to measure their drug policy's compliance with human rights conventions? It is known, as mentioned, that there are many human rights abuses that go undeclared and denied by the countries responsible.
Thank you. Ruby Lawler. At the end of the day, no country, we can't have a police system in place which makes sure that these things are done. But at the same time, it's a question of developing an assessment tool and developing your trust. And as I started off in the beginning with Article 1 of human rights, and do unto others as you would have done unto you, if we provide the tools in which this can be seen to be done, at least internally, and start the process going, then the chances are in the future that yes, that countries, there'll be less human rights abuses, and in those countries where there are human rights abuses, then they themselves will have to answer to themselves on what they've done and what they've not done. So the question of compliance, at the end of the day, is up to the countries to self-assess and decide whether they're abiding by the conventions or not. Thank you.
Thank you very much, Richard. And I propose to continue with another question, which perhaps goes more to Piotr, but also others who are involved in the Drug Policy Academy. We have Javed Mahmoud with us here, who is from the UN Human Rights Office, and he has a questions to those involved in the academy, but also the executive secretary, on how the Pompidou Group can support the implementation of the international guidelines on human rights that was launched at the 2019 CND session. Do you think the international guidelines could be included in the curricula of the Pompidou Group Drug Policy Academy? Perhaps Piotr or Denis could quickly react on this.
I can make a quick answer, and the answer is yes.
Thank you, Denis. I see also Richard is nodding intensively, and it is because we do have another session during the CND on Wednesday about human rights in actions, where the Portuguese experts will also speak on the human rights self-assessment tool and other issues on how the Pompidou Group is planning to support the implementation of the international guidelines on human rights. So I invite you all who are interested in this topic to join this other session moderated by Javed on Wednesday.
Press also one additional remark is that one of the two sessions in Paris during the anniversary celebration on the 20th October will be dealing exactly with the topic of human rights. And of course, the international guidelines will be part of it.
Can I just say that with the human rights compliance self-assessment tool, Damon Barrett is part of the working group, who was in part responsible for developing the human rights guidelines. So we are actually using that as a basis to prepare the assessment tool. Thank you.
Thank you very much, Richard. And I go on with the next question from Karen Mamo concerning the voice of the people who use drugs. The question is, will the voice of people who use drugs is most of the time, The voice of people who use drugs is most of the time silenced by experts in health and other fields. From a human rights perspective, how important are peer-led groups, especially their participation and consultation, to draw up policy and legislative framework? And perhaps we can join right away another comment from the point of view of the communities of people who use drugs. How will the Pompidou Group ensure that these networks that represent people who use drugs and grassroots organizations be invested in the Pompidou Group's work? Who would like to?
I think I can reply to that question.
Yes, I think so.
It is absolutely important to give the voice to the people who are using drugs and also to their relatives. And this is what we are doing when we are cooperating with civil society organizations. We also have set up in 2020 platform, which is called Save Lives, Protect People, which is exactly about giving the voice to people who are using drugs and their relatives in order to make sure that the problems they are facing due to the COVID crisis and also the solutions which are found on the ground are being put at the conscience and knowledge of public decision makers. And last but not least, another very important opportunity where voice of these people will be heard is the second European seminar on drug consumption rooms that we are organizing on the 1st of July in Strasbourg in the framework of the 50th anniversary. This is, of course, an important occasion, and we intend to make it a regular feature of the Pompidou Group, meaning that we would organize such a seminar, such a European seminar, every 2 years.
Thank you very much, Denis. I think you have pretty much touched upon all the aspects on how Pompidou Group is planning the work on this matter. We have a last question from Andrina Algarin to Richard. The question is, what documents, other tools are being used as a basis for the self-assessment tool being developed? Are the international guidelines are used as a basis, which you, I believe, already answered, but in case you have any other additions to make, Richard, please do.
Just one thing, as you rightly pointed out, I mean, I just mentioned this a minute ago, and in addition to the international guidelines on human rights, Damon Barrett is also participating in the working group. So he brings all his experience in human rights, and that he collected or used when he was part of the group developing the international guidelines. And the other question I just saw, will human rights be part of the course or the thing to be offered by the International Drug Policy Academy? Yes, it's well embedded into the course. So it will be available for those who want to apply for it later on. Thank you.
Thank you very much. I think this is all, and just would like to convey to you the numerous comments in the chat thanking to the presenters for their presentation and congratulating to us for the anniversary.
Thank you, Ursulia. I think we are coming to the end of this side event because there's a lot to do in this TND meeting. And I think the framework was clear. So coming to the end, I want to thank you all the presenters for the presentations and for their openness to reply to the questions posed. I also want to thank the Secretariat for the organization of this event and all the attendees that that joined us. In the number of 78, I think it was the number I saw.
81. 81 was the highest number.
Yeah, good. Thank you. Thank to you all for joining us, and I hope that you can join us also in the next events related to the 50th anniversary. You are invited, namely, we don't know exactly how the next steps will happen. If we are if you still need to do some of the events by virtual means, I hope you can meet in person as soon as possible. Because I think we are all a little bit tired of this type of meetings. But meanwhile, please keep safe and pay attention to the activities of the Pompidou Group. Join us whenever you want, whenever you feel that it can be useful for your work, for delivering to your citizens the best level of care that we are also, all of us are aiming for. And I think the contribution of the Pompidou Group is really important together with other organizations, of course. We are not alone in the world, but I think the synergies that we are very committed in the bridges we are very committed in building are really important to have better policies and better care and better reflection about the needs of the people who need our political and technical efforts. Thank you to you all, and I hope you have a nice week of intense work in the next few days. Thank you, and I think we can end. Please, Piotr, please.
I have to apologize because probably you noted that for some minutes I had to